Selective mutism. Explained: signs, symptoms, and treatment options. Understanding selective mutism. Have you ever heard of someone who can speak perfectly fine, but suddenly becomes completely silent in certain situations? It may seem like shyness, but it's actually a condition called selective mutism. Today, we're diving into a topic that's not only misunderstood, but often overlooked: selective mutism. In today's video, you will find its meaning, history, symptoms, diagnosis, treatment options, and how diet, supplements, and complementary methods could help. 1. What is selective mutism? Selective mutism, or SM, is an anxiety disorder in which a person, most often a child, is unable to speak in specific social settings, such as at school or in public, even though they can speak freely in more comfortable situations, like at home. It's not that they choose to be silent, rather, anxiety literally paralyzes their ability to speak. 2. History of selective mutism. Selective mutism has been around for a long time, but it was often misdiagnosed or misunderstood as extreme shyness or defiance. In fact, it wasn't until the late 19th century that this condition began to be documented in medical literature under the name elective mutism. The term implied a choice not to speak, which we now know isn't accurate. In 1994, the name was changed to selective mutism in the Diagnostic and Statistical Manual of Mental Disorders, DSM-4, reflecting that it's not a choice but rather an anxiety-driven condition. This shift in understanding has helped pave the way for better recognition and treatment. 3. What are the symptoms? The primary symptom of selective mutism is an inability to speak in certain social settings, despite the ability to speak in other, more comfortable environments. However, SM often comes with a range of associated symptoms, such as 1. Excessive shyness or social anxiety. 2. Stiff or awkward body language. 3. Avoiding eye contact. 4. Clinging to parents or caregivers in public settings. 5. Difficulty interacting with peers or adults in social situations. Importantly, these symptoms aren't due to a lack of knowledge or physical inability to speak, but are instead driven by intense social anxiety. 4. How is it diagnosed? Diagnosing selective mutism can be tricky because it's often confused with shyness or speech delay. However, key indicators include: 1. The condition must persist for at least 1 month, excluding the first month of school when kids often feel nervous. 2. The child can speak normally in other settings, which rules out speech disorders or developmental delays. Diagnosis typically involves observing the child in various settings, reviewing their medical history, and sometimes conducting interviews with parents, teachers, or counselors. 5. Is it a new condition or a misunderstood one? Although selective mutism has been recognized for over a century, it was often misunderstood or misdiagnosed as willful silence, defiance, or even autism spectrum disorders. Advances in understanding anxiety in children have brought more clarity to the condition, especially in the past few decades. So while it's not a new condition, it has only recently been fully recognized for what it is: an anxiety disorder that can be effectively treated with the right approach. 6. Can selective mutism be treated? The good news is yes, selective mutism can be treated. With early intervention and the right approach, children and even adults with SM can overcome the condition and learn to communicate effectively in social settings. However, it's important to remember that the key to treatment lies in understanding that selective mutism is rooted in anxiety. This means that treating SM requires a combination of techniques designed to reduce anxiety and build confidence in social situations. 7. Treatment methods for selective mutism. There's no one-size-fits-all approach to treating selective mutism, but there are several effective methods. Let's take a closer look at some of the most common and successful treatments. A. Behavioral therapy. Behavioral therapy is often the most effective approach. Specifically, cognitive behavioral therapy, CBT, is widely used to help children manage their anxiety. Through CBT, children are gradually exposed to the situations that trigger their mutism, but in a controlled and supportive way. This technique is called desensitization. 1. For example, a therapist might first have a child practice speaking in front of a trusted person like a parent. 1. Slowly, they would introduce a new person, increasing exposure step by step until the child can speak more comfortably in various situations. B. Stimulus fading. Another technique is called stimulus fading. This involves starting with the child speaking comfortably with someone they are familiar with, like a parent, and gradually introducing other people into the setting. The presence of new people is slowly increased, while the anxiety level is kept low, until the child becomes comfortable speaking in front of others. C. Positive reinforcement reward systems can be a great motivator. Positive reinforcement encourages children to gradually speak by rewarding small steps. This can be as simple as praise, stickers, or any reward that motivates the child when they make progress. D. Speech and language therapy. Although selective mutism isn't caused by a speech problem, speech and language therapy can still be beneficial. Therapists help children with SM practice communication in a safe and encouraging environment, focusing on boosting their confidence and comfort with speaking. E. Social skills training. Children with selective mutism may struggle with the social aspects of communication, like making eye contact or responding to social cues. Social skills training helps them practice these elements in low-pressure environments, building up their comfort and competence in social settings. F. Medication. In some cases, particularly when anxiety is severe, doctors may prescribe anti-anxiety medications or antidepressants. These medications don't cure selective mutism directly, but they can help reduce the overall anxiety that triggers the mutism, making therapy more effective. Medication is usually considered when other methods haven't been enough on their own. 8. How long does treatment take? The length of treatment can vary from person to person. Some children show improvement in a matter of months, while others might take longer, especially if the condition has gone untreated for a long time. The most important thing is to remain patient and consistent. With the right support system in place, children with selective mutism can make great strides. 9. Can natural remedies help treat selective mutism? While professional therapy and behavioral techniques are the most evidence-based treatments for selective mutism, some parents and caregivers explore natural remedies and lifestyle changes to help reduce anxiety, which is the root cause of the condition. It's important to note that natural treatments can complement traditional therapies, but shouldn't replace them. Let's dive into a few natural approaches that may support children dealing with selective mutism. A. Diet and nutrition. There is no specific diet that cures selective mutism, but certain foods may help reduce anxiety and support overall brain health, making it easier to cope with the triggers of mutism. Some ideas include: 1. Omega-3 fatty acids. Found in fatty fish like salmon, walnuts, and flax seeds, omega-3s are known for supporting brain function and reducing inflammation, which can help regulate mood and anxiety levels. 2. Magnesium. This mineral is known for its calming effects and can help relax muscles and ease anxiety. 2. Foods rich in magnesium include leafy greens, almonds, avocados, and bananas. 3. B vitamins. B vitamins, especially B6 and B12, play an important role in reducing stress and supporting nervous system health. 3. Foods like eggs, whole grains, and lean meats are excellent sources. 4. Avoiding processed sugars and caffeine. These can worsen anxiety in children, so focusing on whole, balanced meals may help stabilize mood and energy levels. B. Supplements. Some natural supplements may also help manage anxiety. However, always consult a healthcare professional before starting any supplement, especially for children. Common supplements for anxiety include magnesium, bisglycinate. Known for its potential to reduce anxiety without causing digestive issues, magnesium bisglycinate may help calm the nervous system. 2. L-theanine. Found in green tea, this amino acid is known for promoting relaxation without causing drowsiness. 3. Ashwagandha. An adaptogenic herb that helps the body adapt to stress, ashwagandha may reduce anxiety levels. 3. However, its use in children should be carefully monitored and discussed with a healthcare provider. 4. Vitamin D. A deficiency in vitamin D has been linked to mood disorders, including anxiety. 4. Ensuring adequate levels through sunlight exposure or supplementation could support mental well-being. C. Homeopathic remedies. Homeopathy is a controversial field, and while some parents report positive results using homeopathic remedies, there is little scientific evidence to support these treatments specifically for selective mutism. However, some remedies are said to help reduce anxiety, including 1. Gelsemium. commonly recommended for people who experience anticipatory anxiety, especially around social events or performances. 2. Argentum nitricum, used for individuals who experience severe anxiety and nervousness in social situations. 3. Silica, sometimes suggested for individuals who feel timid and lack confidence, particularly in new environments. Again, it's crucial to consult with a qualified practitioner before starting homeopathic remedies, as they may work best when tailored to an individual's specific symptoms and personality. D. Mindfulness and relaxation techniques. Natural methods like mindfulness and deep breathing exercises can help children manage anxiety in the moment, especially when combined with more structured therapy. 1. Mindfulness meditation. Teaching children to focus on their breath or the present moment can help them manage anxious feelings when they are in a situation that triggers mutism. 2. Progressive muscle relaxation. This involves tensing and relaxing different muscle groups to reduce tension in the body. 2. It can be a great tool to practice before entering social situations. 3. Yoga. Simple yoga poses and breathing exercises can help children reduce stress and gain more control over their body and emotions. 10. Are natural remedies effective for everyone? Natural remedies and lifestyle changes can be great complementary treatments for reducing the anxiety that triggers selective mutism. But they should be used alongside evidence-based therapies like behavioral interventions. What works for one child may not work for another, and a personalized approach is always the most effective. As we've seen, selective mutism can feel overwhelming for both the child and their family. But with the right combination of therapy, support, and potentially natural remedies, progress is definitely possible. It's important to remember that each child is different, so finding what works best for them is key. If you think your child or someone you know may be struggling with selective mutism, we encourage you to reach out to a healthcare professional for a comprehensive treatment plan. The earlier the intervention, the better the outcome. Don't forget to like this video, subscribe to our channel, and hit the notification bell so you won't miss our next video, where we'll share practical tips for parents and caregivers on how to help children overcome their anxiety.